Perspectives
with Twin Alabi at 9 a.m. Mondays to Fridays on Invicta 98.9 FM.
Perspectives.
All sides, all views, all individuals are welcome.
Good morning and welcome to the program Perspectives on Invicta 98.9. This morning, Thursday, we are looking at the pandemic and the situation all over the world. It is no news that the world is going into a second wave of this virus, and of course measures have been taken to see that people are safe. We're recording deaths. And of course, people being hospitalized now because of the second wave of the coronavirus. But back home in Nigeria and back home here in Kaduna, it is getting worse. It is getting worse so much that we had a media chat with the executive governor of Kaduna State yesterday. And of course, he expressed his concerns about the second wave of this pandemic. It is a situation that we must all go back to what we were used to doing, and that's talking about the protocols that were put in place to keep us safe from coronavirus. It is very important, very, very important that we go back to what we were used to doing, and that's staying safe with the protocols that have been put on ground. And of course, this program, we must say, is sponsored by Kaduna State Ministry of Health. It is to keep us informed, and of course, to get us, on top of the situation that we have on our hands. Dr. Ibrahim Jimoh, Department of Community Medicine, Barao Diko Teaching Hospital, and also a consultant public health physician, is my guest this morning. We shall be talking about what we have on ground in Kaduna State, and of course, why we must, and I still say it, that we must keep to protocols to keep us safe from this pandemic. Dr. Ibrahim Jimoh, good morning and glad to have you again.
Good morning. Good morning, Mr. Tony Alabi.
Thank you very much.
Good morning, our listeners.
Thank you. Well, just give a background there about our concerns, here in Kaduna State and of course Nigeria. And we know what is happening in the world. Lockdowns, and of course it's this Christmas period again, festive period, where people interact, people are kind to each other, people spread joy, and of course people do all the things that will call for humanity to do. But what we have in Kaduna State and the concerns there, what are the things you're observing?
Thank you very much, Mr. Tony Alabi. I think we must let our people know that we are having high rising of COVID-19 Kaduna State, and the rate at which we are going is alarming. And that shows that people are now following the COVID-19 guidelines and protocols, which involves this thing we normally explain, which is observing physical distancing, avoid crowd as much as possible, and hand washing use of alcohol-based hand sanitizer to wash our hand where there's no availability of water, and so on and so forth. So the thing is very serious. People are just going busy around without wearing a face mask, and in the process people are getting infected daily, and cases are rising. As I'm presently talking to you, we have double positivities within 1 week in certain local governments, and the state ministries are sending special team to go to those local governments to do massive community screening, targeted screening, and active case search as I'm speaking to you. So that is the situation we have at hand.
Well, again, as we're looking at the situation, the governor himself had come out to say that he had to, stay away from official duties, of course, what we do know as quarantine again this time because of concerns about his health. And of course, top government officials too also involved in all of this. So it is a case of serious concern, but we must at this time be looking at measures, are to be put in place. The first experience was not, too good for us, especially when we were talking about palliatives. Government trying to assist, or the people here. Are you looking at a situation where we might be forced to go on this lockdown?
Yes, it will be very unfortunate if you go back to lockdown, and nobody is praying for that, especially when we're an economic recessions where people cannot involve in their market or buying and selling. People are suffering from hunger. So the most important thing to do now is to observe these guidelines to prevent lockdown as much as possible. Because the moment you have contact with somebody that has been confirmed, the most essential thing to go and isolate yourself, at least until these 14 days elapse. If you have symptoms, then you go for testing for confirmations. But if there's no symptoms and there's no problem, after 14 days, you can't be allowed to go back to site. And that's exactly what the executive governor is doing presently, because few days ago he confessed that he has contact with the close family members. As a result of that, he has to go on self-isolation. So people must observe this guideline very, very strictly. Otherwise, the governor may be compelled to lock down the state if people are not adhering to those guidelines and principles.
And one of the things that came out from the chat, the media chat with His Excellency Malam Nasir El-Rufai yesterday, was he called on the public, on those that may be close to him, those that may want to talk about business, that he does not want visitation. In fact, he said that he does not want people coming to visit. He said, it's not the time to come to visit him. And so, this is Christmas period. This is festive period. A time that we all do know what happens, where we visit each other, when we exchange, love and kindness to each other. This season, what would be your call, on the public?
Yes, thank you very much. People must realize that you have to be alive to be able to witness so many Christmas seasons. If you are not alive, you won't be able to have the opportunity to witness so many Christmas periods. So, and there's always another Christmas. So people must observe this guideline during this Christmas. Avoid crowd. Let everybody celebrate the Christmas in low key, just as we have been doing so many Salah periods. This is not the first time we're experiencing that. I think last 2 Salahs, people are not allowed to go to Eid to pray. So there's nothing big deal like that. If you allow and we're able to curtail this virus as early as possible, we have opportunity to witness so many Christmas. So my advice to people is to avoid crowd, observe social distance, even within your family, limit visitors as much as possible, and let have low-key Christmas celebrations. We can only be able to witness, it's when you are alive that you'll be able to witness so many Christmas, and we want people to be alive to witness so many Christmas periods.
The world is celebrating, the discovery of the vaccine for COVID-19 now, and as we are celebrating, this that we have a vaccine now, we also are recording deaths, and of course hospitalization again taking place, and so they're going hand in hand. What we see now, but for us here again, the question one may ask is, with all the protocols in place and that we must observe them, schools have been shut, have been told to vacate. Transport is another form of where we avoid physical distance, but they're back. And you also mentioned, and we do know that we are into another recession now, and so the economic bite, we all can feel it. But what are we to do about transport? We're on with it, and of course no observation there. The markets are opened, and of course we're having physical contact, so to say.
Thank you very much. I think something needs to be done concerning the way our drivers pack people into their buses, and government must instruct Castelia and other road safety agencies to make sure people are there to these COVID-19 principles. I think that is the most important thing. Castelia must make sure the number of people that are carrying the buses or keke napep are reduced drastically to the extent that they will not be able to be able to maintain some form of physical distance and enforcing use of face mask. That's also very, very important. If everybody use face mask, I think the rate of transmission will be reduced drastically and will be able to break the chain of transmission. But without people observing all these guidelines, it will be very difficult to curtail it. And at the end of the day, the government may be forced to impose the lockdown. So also in the market, I've said it the other program that we should not expect government to come and be policing us. In market, they have market association executives. They should be able to form a task force that will be able to enforce all these protocols within their market. And they've suffered a lot. There was a time the government have to close down the market for about a period of 4 to 5 months, which was very, very unfortunate. So they should not do anything that will force the government to close down the market again. Whatever they can do to cooperate with the government to be able to observe these guidelines, it will help a lot, because it will help us in the ability to break the chains of transmission. And that's the essence of why the government is making all this sensitization and campaign.
The social media, good thing, bad thing, and again, good thing in the sense of what we learn and information and all of that is coming from there. But again, the bad side of it is that some negative information, misinformation also comes from there. We do a lot of, we read a lot about, how countries of the world have treated coronavirus, what we have to do back home and all of that. For some of the measures that have been, for some of the information given out, from the social media about how we must take hot water or, get ourselves steamed up, breathe hot water and through nostrils, because when we're talking is the disease that comes from the nasal, angle. So, are there things that one can do apart from the protocols that have been put on ground? That again, just matter of safety measures that before we get to our hospitals or see the doctor.
I think what I would say concerning that, people must verify information coming from social media before they adopt it. Most of them are not correct, and that's what we call their myths and misconceptions concerning this COVID-19. Talking of sneezing of hot waters or taking of hot tea or lemon or whatever, these are myths and misconceptions, I must tell you. There's what people need to understand, that there are so many viral diseases that present the way this COVID-19 presents. So if you are lucky, you are having other form of cold or flu-like symptoms, and you take hot water or whatever, hot tea water, and you are able to get relief, that does not mean you are treating COVID-19. It's the COVID-19 you are dealing with. And until you take test and confirm that it's COVID-19, you can never be infected because of whatever you have been taking. So right now, these things have no cure. We can only manage symptomatically. And as we always say, 80% of those carry this virus don't even know, or come with a milder form of disease. Even if you don't take anything, it will go on its own without taking anything. So it's not your hot water or whatever tea you are taking that is relieving you of COVID-19. You are just find yourself to be lucky that you are carrying milder form of it, or it is something else, other form of corona. We have other form of corona. There's what we call SARS, severe acute respiratory syndrome. We also have MERS. They all belong to the same family. But this COVID-19 is a novel virus, is still under investigations that up to now we don't have the details of how the disease is all about, and that is why the most important thing is to observe these non-pharmaceutical interventions. And those are these non-pharmaceutical interventions: wearing of face masks, maintain physical distance, washing of hands, personal hygiene, and so on and so forth.
Doctor, I would want, for the benefit of the listener, to also look at the areas. What are the signs to tell us that you might just be having the coronavirus? What are the things to look out for
Yeah, thank you very much. The basic signs to look at for number one, you might be having fever with cough, plus or minus breathing problem, difficulty in breathing. But the other symptomatic signs that are non-specific to COVID-19, but you can also find another disease that you may also be having, such as general body weakness, fatigue, headache, abdominal pain. Some may be having diarrhea, some may be having fever. But recently, we also find that people that have loss of taste and loss of smelling, it seems to be more closer to COVID-19. So anybody that present with loss of taste and loss of smelling, we normally ask those people to go and do test. But we must have in mind that you can only know you have COVID-19 only when you are confirmed. You have confirmatory test. That is when you can have, you can tell you have COVID-19. So all these things we have mentioned can also be found in other flu-like symptoms. And you know, this weather we're having a very cold period, people present with cough and catarrh and so on and so forth. So which is also almost similar to COVID-19. And unless you are taking tests, that's why we are advocating people to come forward for the test. Tests are free. So government has presented the enabling environment for people to come forward for the test. So you should have notion of health-seeking behavior. We should improve our health-seeking behavior. If government can bring out, this test is very, very expensive test. So each test costs about almost 50,000, and government are making the test available free of charge. You can imagine when we are asked to be paid for the test, you could imagine what kind of people, what people will be going through. How many people can afford it? So government have provided the enabling environment, push out health workers over there to make the test available everywhere. In all the local governments, we have testing kits where people are moving from one community to another. And we also have a designated health facility in each local government that if you cannot even wait till when people come to your community, you can easily go to that health facility to go and take the test. So people should imbibe the culture of health-seeking behavior. Please come forward. Is there in Barau Diko, is there in Yusuf Danso, is there in general hospitals, the Gasa, and all those general hospitals in all the local governments. The testing areas, testing kits are available in those areas. So people should come forward. And it's only when we do test, we can know the rate of infection in the communities. You see recently, our testing capacity in Kaduna State has increased. Probably that's why we have doubling number of people that are coming down with positivity compared to, even there was a day we were even ahead of Lagos. It was surprising, almost 171. It has never happened like that before. So people should come forward to the test. The tests are free and nobody is charging anybody for the test. So it is when you get tested, you'll be able to know your status and be able to isolate you so that you don't infect your family, you don't infect your community, and the community will be kept safe.
Doctor, again, people present with headaches, fever, whether mild or at the top of it, and of course coughs. And we do this treatment by going to the pharmacy and of course get our drugs. So is there a concern where can COVID-19 symptoms, as I've said, it presents with some of these things that we have identified?
Yes.
But can we treat them? If I have a headache, I know just what to take. Could that be another area where you may be having some concerns there?
I think the most important, the moment you have history of fever or headache, please go and take the test first. Then seek doctor's opinion. Stop going to these chemists and so on and so forth. Because in the chemists, whether they know what is wrong with you or they don't know, because they want to sell their drugs, they will certainly give you certain things to take. So the most important thing, come forward for the test, then seek the help of the specialist, the healthcare provider, for you to know what to go for. But go for the test first. The moment you come down with fever, headache, whether with signs of upper respiratory sign infection and what have you, go for the test first. The tests are available free of charge.
Okay, and the program is Perspectives this morning and coming to you on Invicta 98.9, and we're talking about the second wave of this coronavirus, and of course it's hitting all over the world, and of course we're recording deaths all over, and people being hospitalized as it is. Nigeria is also presenting a high rise of it. And back home in Kaduna State, we're also saying that people must go back to the protocols that have been put on ground for us, to be safe from coronavirus. The executive governor of the state, Malam Nasir El-Rufai, had come to say that he's had to isolate himself, and of course top government officials have also been said to showing signs of it, and also have gone into isolation. And so the governor wants his citizens safe and of course healthy. And so our responsibility on what we have to do on our own path, and it is very, very important, like Dr. Ibrahim Jimoh has been stressing, that we must maintain the protocols, and of course these are things we all know, and we must do them in order not to go back to another lockdown. We do know at this time that Nigeria is going through an economic recession, the second of its type or its kind in 6 years, and of course it is biting very hard. Christmas is around the corner, and of course we know that people are doing their little shoppings here and there, mixing and mingling up. All of that is taking place now, but we're saying that we must keep ourselves safe. If we do go on a lockdown, don't know what the situation will be. We'll go for a break, commercial break. We'll be back with you shortly.
Invicta FM.
Welcome back. Is the program Perspectives this morning, and Thursday's edition of the program is sponsored by Kaduna State Ministry of Health, and here we talk about COVID-19 and of course government and what it is doing to keep its citizens safe. And with us this morning, Dr. Ibrahim Jimoh is of the Department of Community Medicine, Barao Dikko Teaching Hospital here in Kaduna, and also a consultant public health physician, sharing thoughts with us this morning. Second wave of the coronavirus is here, and it's all over the world, and of course deaths are recorded, and again people have been hospitalized, and back home in the continent, and of course coming close home here in Nigeria, and of course what is happening in Kaduna State. There are concerns. Government has expressed that at the federal level, and coming back to the state level, these concerns are also showed that we must stay with the protocols that are in place to keep us safe from the COVID-19. That's what it's all about now. We worried about going on a second lockdown, and of course we know what the situation may turn out to be if the government has to take, if it has no option than to ask for a second lockdown. And we are saying that it can be avoided. It can be avoided if we play our part, and that's by staying with the protocols that have been put in place. As keep yourself, safe by washing your hands. We know that keep the distance. That's physical distance. Keep your physical distance, and of course maintain the hygiene of staying safe. And also eat good food. Diet, as we say, is also part of it. And of course, wear the face mask at all times, when in the midst of people, or when you're having a gathering. All of these are put on ground to keep us safe from COVID-19. And so now that we're still talking about second wave of it and how to avoid it, Dr. Ibrahim, again we're coming back to high prevalent areas that we've noticed. Is there something that can be done? Because again, we know that before this time, some local governments were showing high rise of these cases. But again, the concern is for the state. But in these areas where Kaduna North has been, on the map, we also know that Zaria is there. We also know that Chukwu local government are all on the rise with coronavirus. But again, we know that intercity, travels are going on and all of that. But really keeping ourselves safe is to observe the protocols. I want to talk about compliance now. And what we're doing here, what Kaduna State Ministry of Health is doing, is to really tell us and to re-emphasize that coronavirus is real. It's with us. There is a second wave of it, and we must be very, very careful this time to avoid another lockdown I mean, that would be the final option. But again, coming out, testing, you've emphasized that testing can be taken, can be had in all the local government areas, but we're looking at people coming out. Are you impressed with people taking advantage that all local governments have, testing places they can go to, but what is the turnout, and are you impressed with the turnout?
We still have a long way to go when it comes to people coming forward for the testings. We may be seeing high rising cases in Kaduna North. Probably we have high testing rate in that local government, because if you look at the caliber of people that are within that local government, you know, say they are highly educated people compared to other parts of the states. So probably people are coming forward in that place. That is the reason why we're having high cases. So my appeal is to other local government to start coming forward for the testing. And it's only when you do testing that you can know whether there's high rising of COVID-19 or not. If people are not coming forward, it will be very, very difficult to know. So we are still not happy with the rate of the testing. People are not coming forward. Yeah, at times you even want to do contact tracing for those that are positive. People will be avoiding. No, they will say, no, I'm not in contact. And instead of them to take the opportunity, this is a free testing something. But people will be reluctant to come forward for the testing. So my appeal is for people to take responsibility for their health by coming forward to do this test, so that we can know how many people are infected, what can we do for those people, so that we can quickly isolate, treat, and prevent them from spreading disease in the community. That's the essence. And the earlier you are detected, the better. Because if you are not detected on time, you continue to spread this infection in the community. And for us to be able to break the chain of transmission, it will be very difficult. So the earlier you come forward for the testing, the better. So that if you know you are negative, you know you are negative. And if you are positive, you be quickly taken to isolation centers and get treated, and you become better. And that is why government is trying to even set isolation centers in all the local government, so that this issue of moving people from rural place to our isolation center in Kaduna will be reduced, and people to hate compliance, because people feel uncomfortable go and pick them from their village. It's like you are you are taking them down for the detain, and it's not the issue. The government is trying their possible best to make sure we have isolation center in all the local governments, so that the compliance will be better.
Well, again, discovery of this vaccine for the countries, where it's been discovered, concerns are about where to take these vaccines to first, and they have a priority list here. So the African continent, when it may get here, with what is happening in all parts of the world, what are your concerns here?
Yes, we in developing countries, we are donor dependent when it comes to these vaccines. So if you are donor dependent, and where the vaccines produced, they are overwhelmed with the infection, of course they will sort out themselves first before they start thinking of considering us. But I think the government of the developing country have continued to appeal to the WHO to see this pandemic as a global something, and to make sure these vaccines are widely distributed, so that some developed countries will not hijack these vaccines. But as I've said before in this program before, people use a lot of money to produce these vaccines. They would like to recoup their money, and these developed countries that have resources, some of them are booked for millions of doses of these vaccines, and they can only produce certain amount at a certain period of time. So before it could get to us, we are lacking resources to even go and book for this kind of vaccine is a serious. So we have access problem. So we pray that we get out of this economic recession, so that government will have enough resources to go and book for this vaccine, so that it will be available as much as possible. But right now, it's not something immediate that we should expect in the nearest futures, unless something dramatic is done.
Well, again, let me talk about stigmatization on coronavirus. Is it still a thing of concern? And of course, we're also saying that we have community transmission now, but stigmatization, is it still of concern now?
Yes, it's still a serious problem, because people, when you are being diagnosed of coronavirus, people trying to avoid you, and that is not the essence. When you get coronavirus, it doesn't mean it's a death sentence. No. So the essence is to identify the individual, isolate him so that it will stop the spread in the community, so as to be able to break the chains of transmission. Right? So stigmatization is what is still going on in the community. That's why when some people are confirmed, they don't want you to bring ambulance to their house, because the remaining part of the community will isolate the family, and they'll be warning their people not to go near the house. You see the members of the community warning their children not to play with the children of the individual. So it's a serious problem, and we must continue to enlighten people that COVID-19 is not a death sentence. So having COVID-19 doesn't mean you are going to die. So especially if you are able to identify the individuals and is taken for treatment.
For confirmed cases, the length or the period of treatment, what is the period of treatment, and at what point can one say within this period I was treated and good to go now?
Yes, it's between 2 to 14 days. Between 2 to 14 days. Even if you are not treated within 2 to 14 days, it is likely that you can't infect anybody. Even if you are carrying out the virus, it will definitely disappear. If it didn't bring you down within that period of time, you are likely to get over it and carry on with your life. So the period of treatment is usually 2 to 14 days.
The program is Perspective this morning, and of course serious concerns here about this second wave of the coronavirus. It's hitting the whole world, hard now, and coming back home to Nigeria and closer home with us in the state, the situation that we have on ground. And all we're doing here is to tell us to keep ourselves safe by observing the protocols. But once your input here, we want to know what is happening in your community, what are your concerns too, and what you want government to look into. These are things that you can help to keep us safe. And so numbers to call to be part of this program: 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Numbers to call to be part of this program, and let's get to hear you, what is happening in your community, and of course some of the things that you have noticed. We'll take your calls. Hello, good morning.
Hello, good morning, Mr. Antonio.
Good morning.
Yes, and good morning to the doctor.
Good morning.
Yes, my name is Mr. Fresh.
Okay.
Yeah, I really appreciate what the doctor has said, but my concern is on one or two areas, in the sense that, one, when some of these symptoms that he mentioned, and one experienced them and decided to go to the hospital, maybe he just feel, maybe it's catarrh or just fever. The next thing is that they will say it is COVID-19 that is disturbing even those that are using, because there is this testimony that somebody just went, and because he just coughed once there, they just concluded that it's COVID-19 and took the person to isolation center. And the person on reaching there, after 1 or 2 days, the person ran away, and the person is living fine. It was not like that. So I want to ask, how do you really know some of these things, and how sincere are those working in the COVID-19 center? How sincere are they? Can they be discouraged on the way that they shouldn't put fear in people? Instead, they should encourage and do the real work that they are supposed to do, and not just draw conclusions that it is so and so disease. Thank you.
All right, Mr. Fresh, doctor.
Yeah, thank you very much, Mr. Fresh. What I want you to know is that we don't take people to isolation center unless you are confirmed, and you can only be confirmed when you are subjected to test. Are you getting me? So they will take sample from you. It's only after your samples turn out positive, So what they normally ask you to do if you have suspicious symptoms is to take sample from you. They ask you to go and self-isolate pending the outcome of your result, because results always take 24 hours to 48 hours before it come out. You know, it's a very large sample size, so it cannot be run within hours. So it's when after the result shows you are confirmed, then they will ask you to come to isolation center. That's why when they are taking your biodata, before they take your sample, they ask you for your phone number, your home address, so that to be able to identify you as soon as the result is come out, and ask you to either to bring ambulance to your house. But it would be very wrong for anybody to just say you are presenting with so symptoms. As a result of that, you should go to isolation center. In fact, we are overwhelming isolation center now.
Okay.
Yes, nobody will take you to isolation center without the confirmation of the.
All right.
Good morning.
Good morning.
Good morning, Victor.
Yes. Good morning.
This is Tunde from Malta.
Okay, Tunde, let's hear you.
Yeah, because I just want to. I overheard that Kaduna State there was this marathon that was held in Kaduna recently.
Yes.
And that COVID-19 protocol was greatly violated. If that is the case, I think Kaduna State government needs to tender apologies to the citizens for bringing this second wave on us, rather than blaming it on us and trying to lock out the places. Because the news I received yesterday about the infection rate, 930 ever in the history of Nigeria, is alarming. And sincerely speaking, it is a call for questioning. How will the government be so careless with the same infection that has been dying? How did they get to the point of resurrecting it again? I think they hold the citizens an apology. Thank you.
Okay, Tunde, we got you there. Don't forget sporting events are still taking place in all of the world. Again, people are just talking about how to contain and to curtail it. But on the marathon that we had in Kaduna State, and of course Tunde demanded for an apology from government because it was a government thing.
Thank you very much, Mr. Tunde, for your concern. But what I just want to say, this second wave of COVID-19 is not only happening in Kaduna State. It's happening all over. It's happening all over the country. Are you saying the hair marathon in Lagos or Abuja or other places that is causing this COVID-19? So we must talk with evidence-based something. So you cannot just this will just be amount to an assumptions. As far as I'm concerned, we normally encourage people, even that have this thing, to involve in mild exercise. You must involve your increase activity of your body, because it will help you to keep fit. So looking at the marathons, I didn't see everybody was running. So it doesn't mean they were hugging each other or they were. So what I just want to say, there's no evidence based on what you said, because the second wave of COVID-19 is happening all over the countries. So and Kaduna is no exception. And if you try to look at all the local government involved in this second wave, do they do marathon in Kajuru or Igabi or whatever? So you can easily see the spread of second wave of COVID-19 in all the local governments. So it was done only within Kaduna metropolis. So that is why it's very difficult to be able to agree with your assertions. But meanwhile, you're entitled to your opinions, and government is listening. So I know they know what to do. Thank you very much.
All right, we're still with it. Still taking calls and, on COVID-19 and where we are. Hello, good morning.
Good morning, sir.
Good morning.
It's Buba Umar.
Buba Umar, let's hear you.
Yeah, sir, we have seen in many cases where second wave has been occurring or reoccurring, that emphasis has been made on contact tracing, quarantine, and the other tenets of COVID-19, that is social distancing and face masking. Now, in the case of Kaduna, they are striving on lockdown, whereas in the second wave, most of the times, the emphasis on contact tracing is where places where the pandemic is high is subject to be quarantine and lockdown. Not the totality of the state to be lockdown. So why is it that Kaduna is striving on lockdown rather than following the tenets from the originator of COVID-19, Wuhan? Thank you very much and stay blessed.
Thank you, Buba Omar. Doctor, you got that?
I didn't get. Can you explain what he's trying to say?
Well, again, Buba Omar, if you're not, too far from your radio or phone, he was talking about we have areas where that has been identified as high rise, of COVID-19. Why are we not dealing with these areas rather than, having the whole state on lockdown?
Yes, the government has not declared. I mean, he has not come out that is going to lock down the whole states. What he's trying to say that people should observe protocols to avoid lockdown. There is not even the best interest of the government to lock down. And if everybody is trying to observe these protocols, I think we'll be able to curtail this on time. What I'm also hearing that it may have to be selected if the people continue behaving the way they are behaving. The local government mostly affected may have to be locked down. So government is not a palatable thing at all for the government to lock down the whole state, because it's going to affect virtually everybody. The economy is in crisis. But when people behave themselves, observe this, have change of behavior and adopt these protocols, I think they may not necessarily go down for the lockdown. So government has not come out to say it's locking down the state for now.
Okay, right. We're still having another call there. Hello, good morning.
Hello?
Good morning.
Good morning, sir.
Good morning.
Good morning is my name. I just want to put this question to your guest here.
Yes, go ahead.
Is it even not better for people to even die of COVID-19 than hunger that is on ground? Are they going to share for palliative for people?
That's it, right? Okay, well, that's another angle to it.
No, nobody is praying that people should die of hunger. Neither do we pray that you should die of COVID-19. But that is something we all averted in all ramifications, whether due to hungry or due to COVID-19, and nobody is happy that somebody is suffering from hunger. So I know government is trying all its possible best to make the economy going so that people have a means of livelihood. And that is the reason why government is very reluctant in coming down with this lockdown. That is the reasons. Because they know there's hunger in town. And it's as a result of that, it pains when government take very drastic decision to lock down the states.
I have another one there. Hello, good morning.
Hello, good morning, Sir Alabi.
Good morning.
My name is Comrade Gabriel Texaman.
Let's hear you.
I think, sir, the emphasis should be very, very seriously on these transporters and the marketplaces. Because some of us, if you enter their to say, look, don't forget that there's COVID-19. You carry out of the 12 you were carrying before, you carry 6. They say, no, if you don't want to down, make you come out. So I think the government with the National Union of Road Transport and the market administration, these are areas that they're supposed to let them cost to us. Once to our duty will come over in our houses. So I think what your discussion there on how to reduce this gathering. Even we in the churches, some churches have reduced their services. What we are holding to, they never make it for, so our people will be less in their sitting arrangement. So, sir, we are playing seriously with the excellency that should emphasize more on the National Union of Road Transport and the marketplaces.
So let us see whether this thing is going to continue. And we thank the governor and wish him early recovery from this COVID-19. Pray for his good health. Thank you, sir.
Thank you, Comrade Gabriel. Well, again.
Yes, thank you very much. We've talked about this even during this program that we have problem with the taxi driver, the buses, about the number of people they are carrying. I think government has come up with the policies on that. I think it need to be enforced, and then the use of face mask while in the buses. So people should indulge the use of face mask, and very soon I think the people will be on the road enforcing this kind of things, because we reach certain stage.
All right. Hello. Good morning.
Hello. Good morning, Mr. Kayalabi.
Good morning.
This is David calling from Prudential.
All right, David. Let's hear you.
Thank you. What I want to understand is this issue of if people are scared of even coming to open up of this COVID-19 is because of this case of stigmatization you mentioned. At least, even if the government wants to do something about people, they should create an enabling environment.
Oh, sorry, David. We lost that call. But Ian, he was stressing on stigmatization.
Yes.
And that how we can help on this matter of
Yes, we've talked it before that having COVID-19 doesn't mean it's a death sentence. So people should just take it as a normal sickness. All what we are interested in is to be able to identify those people on time so that they don't spread the disease in the community. So it doesn't mean when somebody is infected with COVID-19, it's a death sentence and people should be avoiding him. That's why we do contact tracing, so that people that have contact with those confirmed cases be able to be isolated, or either they go on self-isolation within that 2 to 14 days. If they develop symptoms, we screen. If they turn positive, we isolate. If they turn negative, they are allowed to go to the community.
All right, doctor. Hello, good morning.
Your call has been placed on hold.
Okay. Well, I might just be taking another call, as the last one. But doctor, quickly, I want to put in this one. Some people still see coronavirus as a myth. Some people just do not believe that it's real. And again, people tie it around religions, and say that God is in charge of all. God gives, God takes. And so with the God we're serving, if we are truly serving him, it cannot be a portion of anyone. Tying all of this to our trust in God. What are you taking? What's the take here?
What my take on that is that God that created diseases creates solutions on how to tackle disease, and he gives those that are knowledgeable those solutions, and that's why we are telling the populace these are the solutions that have been laid down. I mean, they have laid down to follow. So if you think you are very religious, or you think something is not in your portion, you are just deceiving yourself. God that created disease have created solutions. So we should have believe our health experts that these are the way to go to avoid being sick. Because if you get infected, you can be debilitated with morbidity or mortality and so on and so forth. And that's what we are trying to avoid.
Okay, and doctor, that will just be about all we can take on the program this morning. But again, I would like you to have a parting shot for our listeners. Again, that this period is festive period, and people will go on holidays. It's a time too that marriages are, taking place all over the place. We're also burying our dead, and a lot of activities this period, and so keeping ourselves safe. Your last line here.
Yes, thank you very much. I just want to tell people that second wave of COVID-19 is very much around with us. So, and we are in a festivity period, so people should follow these COVID-19 protocols very, very strictly, because you have to be alive to witness other festivity period. So I can only wish us best of luck, and people should try to play safe. So only when you are alive that you can witness another year. And I wish you the Happy New Year's in advance, and best of luck.
And that's it about the program Perspective this morning, a program sponsored by Kaduna State Ministry of Health. Dr. Ibrahim Jimo of the Department of Community Medicine, Barau Diko Teaching Hospital, and consultant public health physician with us in the studios. Well, again, emphasis here is to stay safe and that we can have many more festivals. But it is very important that we stay safe and alive too. And of course, by observing the protocols that are on ground for us to be safe. I'd like to thank my colleague, Prince Highness, for connecting us with the people this morning. Wisdom for putting us in the pictures. We'll come back with perspectives tomorrow. Good morning.